until we are certain that we have enough beds for everyone. Go ahead.
Last question for today. We have Seth from City Journal.
Hi, Mayor. Looking at the data from your health department on new hospitalizations, it appears that the numbers have stabilized and are dropping. At a peak, and this is due to the lockdown, I think, at a peak, they were 820 hospitalizations in one day. Now, your projection that we'll need an additional 85,000 beds...
No, total. I'm sorry, Seth. Total 85,000. 20,000
okay,
we started with plus 65.
Okay, another 65,000 beds. We would still really need to be past peak hospitalizations for 2 months with no one recovering or dying. So it seems like your projections aren't really matching the current data. And I was wondering if I could get some clarity on that. The number of new hospitalizations appears to have peaked and is going down. It would have to be accelerating for us to need so many tens of thousands of new beds.
Well, let me contest that. I'm going to start as the layman, and then we'll go to Mitch, and then if Oxiris wants to add. So first of all, I'm going to say these two are much more scientific in their training than I am, but I think they'll agree with this opening statement. It is too early to make any, I'm not trying to say, I think your question is a great question. I'm not trying to say this about your question. I'm trying to say this about anybody observing, particularly in public life. It's not time to pronounce the direction that this is going in because it's still early. And we are preparing absolutely for worst case scenarios. So Seth, if it turned out, a month from now, if your question was, wow, it turned out to be a lot better than you projected and you had too much ready to handle the problem, I would be very, very happy with that question. But we have to plan for worst case scenarios. We've seen this. This is a ferocious disease. And the number of cases, the way they've grown, the number of hospitalizations and ICU admissions, we are projecting that at some point next week, we could be as high as 5,000 people intubated simultaneously in New York City. I mean, that's an astounding figure. So I don't see it as we have any evidence yet that things are turning in our favor. The other thing I would say is whenever you reach the peak, and certainly from our conversations I've had at least with national healthcare leaders, they think we're still a ways from it, and that's just the infection peak. There's still a lag time in terms of how that turns into hospitalizations, and particularly in the ICU. I think there's a lot tougher times ahead, as I've been saying, but also remember, you're talking about people who may need to be in the hospital for weeks, folks who are on those ventilators. Many times that's 3 weeks. And now Mitch and Oxiris will go into more detail. You got to think about the bed through the lens of the human being and what they go through. And a human being who's in that bed for a month or more, or someone who's convalescing for a period of time, all of that takes the bed and the staff, the equipment, everything. And there's another person coming in, another and another and another. So I would argue when you look at the whole equation, we're going to need a whole lot, and it's going to sustain for certainly weeks on end. You want to add, Mitch?
I think the mayor has characterized it correctly. The huge bolus still continues to be intensive care unit. So a good example, Elmhurst, right at the forefront of this pandemic in New York City, had an ICU of 29 beds under normal circumstances. This past Monday, they were up to 110. Today, on Friday, they're up to 150. So these are all patients who are extremely ill. At least 85% of them are on ventilators. And the level of intensity of staff needed to care for somebody who's on a ventilator, often they are on also multiple medications by vein at the same time in order to maintain their blood pressure, requires an extreme amount of staffing. I think some of the overall census increases, as you were asking, I checked myself, and in health and hospitals for the last 3 days, we're higher each day than the day before. But I do agree that the real boluses are around the ICU more than on the regular medicine patients.
And then I'll just add that in terms of looking at the broad trends, that we're looking at data from emergency departments as well as data related to admissions, the overall trend is that this is not slowing down. And the mayor's absolutely right in terms of the bolus to the system. The other thing that I will say is that it's normal when you look at the upward trend to see a sawtooth pattern into that. And so I wouldn't make too much of a curve going down one day because we're on a trajectory for it to continue upwards.
And obviously, look, everyone, the day that we can say, and there's a conversation all of us have quite frequently, the day that we are convinced the worst is behind us and things are going to truly consistently get better, we will be right here at City Hall telling you that for sure. But until that time, we don't want false hope. We don't want people, relaxing prematurely or losing focus. We're going into the thick of battle. And I think it's absolutely crucial that people understand that. I've had this conversation with a lot of New Yorkers and a lot of people who are really deeply, deeply involved in the life of the city. And what I've heard consistently, and I had this conversation with one of the greatest of all New Yorkers, Cardinal Dolan, and he said, tell it like it is. New Yorkers appreciate that. They want to hear the truth. They want to hear what we're about to go through, even if it's going to be tough. People would much rather hear exactly what we know and then be ready for battle than have it sugar-coated. But we know New Yorkers can get through anything, and people are really showing tremendous solidarity and strength. And we also know that this is a battle that will not go on forever. It will go on intensely for weeks, as I've said, April and May, and then we'll start to get some relief. And then one day life is going to get back to normal. It is a battle that will end at one point, and then we'll all recover together. But in the meantime, we'll tell you every day what we know to keep all of our fellow New Yorkers informed. Thank you, everybody.